Hello, everyone. Welcome to this NPC event. I know some of you had trouble joining the link, so thank you for your patience with that, and hopefully everyone will be joining us now. I can see that people are now coming in, which means hopefully the right link's gone out, which is great. So welcome to this NPC event. I hope you're all managing to stay cool somewhere. For those of you who don't know NPC, I'll just say a bit about us. We are a think tank and a consultancy for the social sector. So we help charities, foundations, philanthropists, corporates and the public sector to maximise the social impact they want to have on the lives of people that they serve. My name is Charlotte Lamb. I'm a principal consultant at NPC in our research and consulting team. And I lead our work on involvement and decision making, and I'm also NPC's lead for children and young people. So I am delighted to be hosting a conversation today with Josh MacAlister, who chaired the independent review of children's social care, which was published a couple of months ago. Prior to this, Josh was the founder and CEO of social work charity Frontline, which aims to transform the lives of vulnerable children by recruiting and developing outstanding people to be leaders in social work and in broader society. Josh is also a teacher by background and is an ambassador for the Teach First scheme. So the independent review of children's social care found that we currently have a system that is increasingly skewed to crisis intervention, with outcomes for children that continue to be unacceptably poor and costs that continue to rise. So for these reasons, a radical reset is what is now unavoidable. So I'm really looking forward to exploring the findings of the review and their implications for the charity sector with Josh over the next hour. But before we start, I would like to invite the audience to submit questions through the sort of Q&A function that you should see at the bottom of your screens, and we'll try and save some time at the end to address as many of those as we can. So without further ado, let's get going. Josh, welcome. And I wonder if first off you could tell us by telling us about how it is that you came to chair the independent review of children's social care.
Yeah, thanks for having me. The government had a manifesto commitment in their 2019 manifesto to undertake a care review, and it didn't say much more than that in the manifesto. And I think as new ministers came in 2019 and were getting advice from civil servants and speaking to people who depend on children's social care, so children in care, families who've got social work involvement, it becomes clearer and clearer to people that look at these issues that actually the whole system is very connected. So to look at care without looking at kinship support, without looking at support for families, without looking at what happens when young people leave care, doesn't make sense, because actually all of that stuff is so connected together. So the government wanted a broad review of the whole of children's social care, which we've not really had a whole look at the system in its entirety for decades. So, you know, quite a big undertaking, given some of the challenges for children and families in the system. And then secondly, they wanted it to be, rather than a civil service led review, they wanted it to be independently led. So they were looking for people to undertake the review. I was asked, because of the work that I'd done at Frontline, having set up something that was disruptive in the children's social care system, so knew a bit about how children's social care worked, lots of areas I didn't know a lot about, and I've learned a lot over the course of the review, but was able to bring a kind of fresh look at some of the ways in which children's social care works. So was asked to lead it and started in March 2021, and then concluded the review about 15 months later in spring of this year, which is what we'd committed to do at the beginning. So pretty intensive period of work. Some reviews can take anywhere between, I guess, 9 months and many years. And with the 15 months, we did a huge amount of work to listen to people who've got lived experience, kind of start from what is it they're saying about what children's social care is like, what is being in care like, what needs to change, and working back from that to come up with a plan that will reset the system so that it does, more than anything else, start from how do we build lifelong loving relationships around children, ideally in their families, and preserving family life if we can with children and their parents. Where that's not possible, bringing in the wider family network much more successfully. So bringing in grandparents, aunts and uncles, family, friends. And then if that doesn't work and that isn't an option, making sure that the care that we can offer as a society for those children who can't live with their families is healing, loving, and lasting. And when you stack that up against the system we've currently got, there's a lot that needs to change.
Absolutely. Well, thank you for giving us that introduction. And I think it really resonates with a lot of NPC's work that's shown that children in care face much poorer outcomes than their peers. And as you said, this is the first review in a long time, so there's a lot to cover. Can you tell us a bit about some of the main findings from the report?
Yeah, I mean, the main issues that we see within children's social care are, first of all, that the system over time has become increasingly skewed towards crisis intervention. So more money, more time, more resource is being spent on care and responding to gaps in support for families earlier on, and our inability to keep families together where it could be safe. And the more and more that's happening, the more it's draining money out of the system that could help families. So we're in a bit of a doom loop where we're spending more on crisis intervention, less money is available for help, which means we need to spend more on crisis intervention, which means we've got less money for help. And breaking out of that cycle is extremely difficult. And some local areas have done it. And that's because of remarkable leadership. Some of the circumstances around the financial health of those local authorities, local need has often helped. It's played a role, but really excellent leadership has helped kind of push local authorities out of that cycle. But that isn't widespread enough, and there are some structural reasons for that. So that's kind of one of the big findings and one of the big issues that we identify. Secondly, that we've got a system that is sometimes quite statist. So it responds with the mindset of providing a relationship as a service. And the problem with that is that many young people and families, they want normal relationships with people. They don't want to be isolated. They don't want to be lonely. They want support. Children want to grow up in families that feel like normal families. And all of that I've just described is often organic, it's rich, it's intimate, it's messy, and public services struggle to generate and support that kind of organic, rich, natural set of relationships. And when children come into care and when families are isolated, often those relationships are frayed, they're quite weak and fragile, and services step in because they can see a problem and professionals want to respond to it. And some of our attitudes about risk and our mindset about what services should do and what's appropriate lead us down a path of responding to this problem of loneliness, isolation, lack of connection, lack of love, by providing more and more services to fill the gaps. And actually, that is the wrong response to the problem. What we need to do is put the system at the service of tending to and supporting lifelong loving relationships. And again, there's some really great examples of that happening already in the system. An incredible project called Lifelong Links, run by the Family Rights Group, which does just that. Lots of other examples, and they're in the report. So that's that kind of the system trying to provide a relationship as a service is another sort of part of the problem that we identify. And then I guess one of the final big things is that we tried through the review to explore a couple of dilemmas that have held us back as a country from resolving some of these questions about how do we provide safety, stability and love for children in their families, and where we can't, how does care provide the same foundations? And those dilemmas are about, what do we do nationally? What do we do locally? What's in the role of local authorities? What's in the role of national government? What should be done by communities? What should be done at a neighbourhood level? And there's no kind of one answer to that, but we've tried to sketch out in the review what should be done at a regional level, what should be done at a local level, and some of the rationale for it. One of the other dilemmas is, how do we have a system that is able to both respond to what are child welfare-led problems, so families, parents trying to raise their children in conditions of adversity. They're not causing significant harm to their children, they're not abusing their children, they need help. That's 90%, 80-90% of families. So how do we do that? Which means it needs to be low stigma, it needs to be really intensive, really skilled, built on trusted relationships with services that are based in communities that the public recognise. And at the same time, have a system which is very decisive and at times quite muscular at intervening in private family life when there is significant harm. And at the moment, we've got a system blended together that does both. And one of the dilemmas that the review really wrestled with was, how do you try and improve the focus on both strengthening a more focused child protection response to significant harm, which needs to be led by practitioners with the greatest skill and expertise, alongside a system which is lower stigma and more accessible for families to help. And we've set out a lot of recommendations for how to get that balance in a better place. But that's one of the dilemmas that we've really struggled with. And I'll just give you an example. We've struggled to kind of figure out widening the range of professionals who should be able to help families in child in need work, because we're worried that if we do that, then we'll lose the social work focus on risk assessment. So that's kind of held us back from taking some steps that we maybe should have taken 10 years ago. Some of the weaknesses of the child protection system stem from a lack of engagement with families in offering meaningful help earlier on. So we've sort of remained a bit stuck on this because we've not resolved that dilemma. And then the final dilemma, and then I'll let you ask another question, is that we explored was about how to get the balance in the system between freedom and responsibility for practitioners, right? And this is a system where, I described it earlier on in the review process as a pile of Jenga, 30 years of layering up procedures and rules in a system, all of which was done with the right intent and often for the right reasons, which was something had happened and gone wrong and we'd put a new rule in place. But when you step back from it, 3 decades on from the Children Act, it's actually very complicated as a system. It's very difficult to navigate. It's not intuitive. And there are lots of examples of the system not meeting children and families' needs because it's too focused on following the procedure. So how do you, in a system which isn't always performing as well as it needs to, actually hand freedom and responsibility back to the front line in a way that gives public confidence? And there's no, that's a difficult thing to do. So, for example, we offer in the review a big investment in professional development for social workers through an early career framework, but there's lots of other stuff that needs to happen as well. So they're the main kind of findings, I think.
Thank you, Josh. And I really like your kind of how you talked about the dilemmas, because this is such a complex system with very, very difficult challenges. There isn't a right way of doing it, and there isn't, there's so many kind of options and trade-offs to be made. So I think presenting that as those dilemmas is helpful, because they are dilemmas, and sort of it allows you to explore those trade-offs and those kind of make those difficult decisions. And very interesting as well to hear about, not just processes, but also kind of cultural things like that stigma that's around families, and interesting that the report sort of tackles both sides and how enmeshed they are really. And there's obviously so many big findings kind of for the review focuses on the social care system. So largely children who are in the care system. And one of the things that NPC has learned through our My Best Life project, which supports and advises, we found that support and services for young people can be really hard to find and not tailored to their needs. And so one of the things I wonder is, how important is it to fix this challenge for those leaving care services? So not just once they're kind of within the system, but once they leave it as well. How important is it to fix that kind of availability of services and support for them then?
Yeah, it's really important because too many young people at the moment leave care and it feels like a cliff edge. That will be something I know lots of people on the call will kind of recognise as a description of that experience of becoming an adult, having left care and leaving, feeling pretty lonely and not knowing where to go for support. And there's sort of two pretty powerful data points for that in the review that we included. One is the findings from Quorum Bright Spots report. Quorum do a brilliant annual survey of care experience people called Bright Spots. Highlights lots of things that work about care as well, which is really good. But it does show that lots of young people feel pretty lonely. They don't know who to go to get support from, and actually some of the strongest relationships they've got are with a paid professional. And I think that, you know, is a warning sign, really. And then Ofsted have done some really great research as well, looking at, you know, where is it young people in care go to get support and advice, and those leaving care, and there's some real gaps there as well. So it's a problem, and it's a problem linked to a few issues. One is that, again, that the lack of an obsession over creating lifelong loving relationships in the care system. So we've said in the review there should be 5 big missions for the care experience population that, as a government, as a society, as businesses, we obsess over, we focus our efforts on. The first of those missions is that every young person leaving care should have at least 2 lifelong loving relationships. Now, that's a provocation because, of course, then people say, well, how on earth do you measure that? Well, the starting point is, well, maybe we should ask some young adults who are leaving care, who is in their life, who matters to them, who do they love, who loves them. And if we're finding that that is a really weak genogram, if you like, if the map of the social connections for that young person are not deep, if there are people kind of missing who should be in their life, what are we doing about it? And what's the care system doing to kind of put itself at that problem and address it? So that's a kind of really critical thing. And the reason that's mission number 1 is because, you know, even if we got housing sorted, even if we improved, you know, the support through mental health services in the NHS, and if we have got all the services working brilliantly for those who've been in care, and they're still by themselves on Christmas Day, the system's not worked. So mission number 1 has to be about those people in your life who are there, who you make sense of yourself through your relationship with them, because you are living your lives deeply connected to, with a sense of attachment and belonging to one another, right? So that might be a young person who's grown up in care and they spend a lot of time with their best mate's family. And actually, okay, well, that's a really important set of relationships. What's the service done to recognize that, celebrate that, bolster that? And that's, you know, the system just doesn't really often put itself with a focus on those questions. So that's mission number 1. And then the other missions are about some of the other services and how we improve outcomes for those who've been in care. So mission 1, lifelong loving relationships. The second mission is about ending homelessness for young people who've got care experience. We set out some recommendations for how to start doing that. So ending the practice of making young people intentionally homeless who've been in care, which is something local authorities could do now. They don't need to wait for government action on that. We could make that happen now. And there's a range of other measures. Improving the quality of career options. So creating 3,500 new high quality jobs and apprenticeships for those who've got care experience. And Sharon White, I've met Sharon, who's the chair of John Lewis, earlier this week. You know, they've got some really ambitious plans and are starting to sort of do some really interesting stuff in that space themselves. The fourth is around educational attainment and doubling the proportion of those who've been in care who go to university, with a focus on high tariff universities. And then finally, it's about narrowing the health inequality gap between those with a care experience and the rest of the population. And that's about mental health, it's about physical health. And so we've tried to say, rather than sort of listing off hundreds of things that every service could do, we've tried to say, look, let's focus everybody's attention on these 5 missions. think about what you can do as an organisation, commit, and then take action. And they're measurable, so we'll know whether or not progress has been made.
Brilliant, thank you. And actually, my next question is sort of related to that question about measurements, because you know, at NPC we like metrics, and we like to know what impact is being made. So in your review, you propose a national children's social care framework that would set outcomes the care system should achieve for children and families. Can you tell us a bit more about what you think the key metrics might be that might measure that progress towards those outcomes?
So we've suggested a few in the report, and I've tried to think really carefully about what is it that we want to be indicators, what is it we want to have as measures. You know, I do have a strong association, affinity with those who have got a critique of new public management. So, you know, some of the worst excesses of targets and managing through numbers. And we have seen some of the worst excesses of that in children's social care. So I'm sort of holding in mind when I was writing the report that this done badly can cause, you know, lots of distraction and unintended consequences in public sector reform. And there's lots of examples of that I'm sure people on the call can give chapter and verse on. So what we've tried to say is, look, at the moment, there is no clear, we've tried to tier it. So basically at the moment, there's no clear objective for children's social care as a country. What is it we want it to achieve? Why does it exist? What you know, what's the purpose of children's social care? So government should say what that is. It's got a democratic mandate to do that, whether you like who's in government or not at the moment. They are elected. I think it's reasonable to expect that a government that's, you know, funding those services and responsible for stewarding them in lots of ways sets out the purpose. So that should be number one. Number two, we should then say what are the what's the wider kind of set of outcomes that we'd expect the system to achieve. Now we point to the Supporting Families Outcomes Framework that is used at the moment by the Department for Levelling Up and Housing and Communities, and which local authorities are using a lot. And it includes some measurement of substance misuse. These are indicators amongst parents often and families, where it's a mix. So we sort of suggest looking at that, and then also looking at outcomes. So what is it? What's the experience that families and children have of services? We don't have a way of capturing that at the moment, other than through one-to-one conversations. So we've got no kind of family and friend test of the system, and that needs to be brought in. And I think would start to change how we think about how social care engages parents and engages children. What are they saying about that level of engagement? So that's really important. And I think we do need to do that, because I think we need to know, are things getting better for this group of children and families or not? Then there are a really important set of indicators, which are about system learning. So what do we know about the use of this type of care versus that type of care, and what's it telling us? And that should very clearly not be a performance management approach. That should be learning in the system and feedback loops, and giving the chance for the system to reflect on the differences and similarities between areas, and in a way bringing much greater transparency to the system about what is going on for children and families in it. And then to support that, we're saying that there should be some guidance, drawing on the best available evidence for how to achieve some of those objectives, and that there should be local discretion over how to apply those guides. But we should be a bit more rigorous about saying, look, if you're not using some of the approaches that are better evidenced, why not? And you know, what confidence have you got that the way you're doing it is better? And a richer dialogue about evidence and interventions within the system, which I think we lack a bit of that at the moment.
Yeah, I think that rich dialogue is so important. And I also really like what you said about system learning as part of this. I think sometimes that kind of gets forgotten about, you know, but actually it's such an important part of that kind of measurement and kind of evidence process as well, looking at what works, and sort of constantly learning from it, and that sort of transparency that can create. So I really like that part of your answer. So obviously there's, so many findings. You've already talked us through some really kind of rich things in the report. I'd like to explore a bit more about what this means for the charity sector. So your report includes some case studies of what charities are doing in this space. So I think there are examples in there from NSPCC and New Beginnings, Young People and Children First. So some great examples of what charities are doing. What did you discover about the role that charities can play in children's social care? And could they do more? Should they do more? And what bit are they best at?
Yeah, well, there are some, lots of examples in the report, as you say, and there's third sector organisations that are able to, either because they've got a kind of national focus on doing one thing really, really well, and they've, worked up the model, figured out how to best execute it in order to bring about change for children and families. So, for example, Lifelong Links, very good example. It's a charity, family rights group that run it. They've spread it around the country. Lots of examples like that, where there's a depth of knowledge and expertise in how to achieve this sort of change that is being spread around the country. And someone who led a charity working in the children's social care system, doing pretty much that type of approach, there are lots of examples of it. So that's a kind of pretty rich ecosystem of charities and third sector organisations. There are then some really impressive hyper-local initiatives that are run by the voluntary sector and charities that have managed to establish a level of trust and connection with the public that state services, statutory services, struggle to engender. And it's been quite striking kind of seeing those and seeing, to what extent is it that because they're not the council, they've been able to build that relationship, or is it that they've been able to create a culture amongst the teams doing that work that could be replicated in the public sector? And actually, I believe there is a bit of that. We could try and engender some of the mindset and approach and culture of nimble, more relationally based third sector organisations into bits of the statutory system. For example, Love Barrow Families in Barrow, which an incredible group of parents helped set up with a great former social worker, has got a level of engagement with families that the services just don't have. Likewise, with Pure Insight in Manchester, in Stockport, and New Beginnings in Stockport as well. They're two very good examples there in the report too, where they've been able to build that connection and trust with families, with parents that and with those in care, that is really impressive. And I think what I've said in the review is that the framework that systems work in, that services work in, needs to reward leaders making decisions that first and foremost start with the public and think, how do we best meet their needs, engage them, and provide support in a way that they're going to get the most from. And that might sometimes lead services into forming deeper relationships with local community organisations and charities, and drawing on the expertise of national organisations as well. And the framework should do that. So it should, if, for example, every local area, families are being asked for their experiences of children's services, and in one area it's very poor because they're saying, I don't know who the social worker is, they're not based in the community, they come from the council office that's 50 minutes away, and every time I need to go to a meeting I need to get on 2 buses to get there, and they talk to me like I'm worthless, and I've had 5 different social workers in the last year. So no, I'm not happy. Compare that to a local authority that's partnered with a local organisation that's been able to build the relationship with the family. They feel like they're part of it. They feel respected and understood. Then that should, that's only one example really of where what we measure starts to shape the behaviour of the system. And we make some recommendations in there as well about what Ofsted should be doing to change its inspection framework or apply its inspection framework in a different way to push at that same behaviour. And I think we might come on to this because I've had a quick look at some of the questions. There's obviously a big, space in care and children's homes and fostering about the voluntary sector, the third sector, charities, and particularly in residential care, where we've seen just a huge increase in the role of the private sector, where it would be very welcome to see a resurgent charity sector, third sector, offering something for children and families in fostering and residential care. And I know that's been in decline for a number of years, and I think it'd be very, very welcome for that to be resurgent, and for local authorities properly planning for the care that children need in the next 5 years, looking to not only do it themselves, but also partner with third sector organisations, charities, where they've got something special to offer.
Yeah, and I think that does it touches on my next question as well. So I think it's a really important point to raise. And I suppose just kind of picking up on that around you saying there's it'd be welcome for the charity sector to be more involved in that kind of children's home space. Is there any evidence really that the charity sector does that better, or than the private sector? Is that something that could be used to sort of try and attract more charities to that space?
Well, one of the problems we've got is that we rely almost completely on evidence from Ofsted inspection reports for the quality of residential care. And it basically shows that whether you're private or public sector, not-for-profit, the inspection framework results are pretty similar. They're not very different at all. And now what we did see a couple of weeks ago, I think The Guardian did some work looking at complaints in children's homes and whether they were a higher rate of complaints from private equity-backed children's homes compared to other ones. They found that there were. But I do think I think we need to be a bit curious about that, because it could be that there is more reporting going on, which would be a good thing. So, I'm just a bit cautious about kind of running with some numbers, but essentially I think the picture's pretty unclear. And I would also say we were here 20, 30 years ago with a local authority led care system that was in lots of places bloody awful. So I don't dogmatically follow the logic that the private sector provides worse care because it's private. I think there are real worries about profiteering in the system, and what happens when you've got a system driven by profit, motivated by profit. That creates all sorts of weird, perverse behaviour that is prioritising the wrong things. So that's why it's part of the reason why I've got children living really far away from where they grew up when they go into care, which is not acceptable. It's part of the reason why we've got a huge growth in the residential care system, but we struggle to have enough foster homes to meet the needs of children. So those are the kind of real life consequences of that, the broken market, and their responsibility for that. It goes around a few places. Local authorities aren't doing good sufficiency planning. We've included some pretty damning evidence about that in the report. The private sector is profiteering, is maximizing its profit, and is irresponsibly stewarding the system because it's underpaying staff that work in their homes to maximize profit share. And national government has been very hands-off and said, carry on as you are. So we've not got a grip of it, and it's why we've ended up where we are. And I don't think that is because we sat down 15 years ago and said we want to privatize this system. I think it's because we've let it drift in that direction, and we need to reverse it. So yeah, I think sorry, you didn't ask me about any of that, but that's anyway tuppence on the wider things that need to change.
Yeah, that's a really interesting analysis of it, Josh, and I think your point around incentives, and how it's the incentives that have sort of driven it to where it is now is very interesting. And one of the things I was thinking as I was reading the report, what are the implications of your report more widely for charities who aren't necessarily working in the care system, but maybe working with children who are care experienced?
Well, we make two recommendations about the care experience generally. One is that all public bodies should be corporate parents. So this is something that happened in Scotland a couple of years ago. At the moment, local authorities are the corporate parent for children in care. And we're saying actually that public duty, that duty on public bodies should be extended to the NHS, to schools, to further education colleges, to universities, gyms, swimming pools, etc., etc. And that by doing that, they should give attention to, consideration to care experienced people who are using their services, and have plans to better meet the needs of that community. And even just as a starting point, understanding who those people are, who is care experienced. And so that's a big one. And that obviously for those who are third sector organisations working with and in the public sector, that could have a big consequence. You could also, I would invite third sector organisations could actually take the step forward and voluntarily do that. They could consider themselves with some corporate parenting duties and say, well, what would that mean for us if we adopted the mindset of being a corporate parent as a big third sector organisation? Then the other thing we recommend, which is very broad, is about making the care experience a protected characteristic in equalities legislation. Therefore allowing employers to take positive action to support those coming into the workplace and into opportunities like university and alike, and giving special consideration to the impact of actions by organisations on particular groups, including care experience groups. And obviously, if that happened, that would have a wider duty on all organisations, including charities. So there's some of the big kind of system things we're doing to say we need to give much bigger focus to the care experience population. But the other thing is, I would say, look, you can read. I'd encourage people to it's a long report, but I'd encourage people to read it because there is stuff in there for everybody. You can do either as an employer. There are many of you will employ people who are kinship carers. Now, does your annual leave policy recognise grandparents who might need to step in and take responsibility for their kin? So that would be something you could do that's really practical and tangible, and you could probably do it tomorrow or next week. So that's just one example. There's tons of stuff in there that I think organisations could do.
Great, and thanks for highlighting that, Josh. And I really like your kind of challenge of thinking. You can already think about what might this mean as an organisation, or what could we do, as well as sort of bigger system kind of things. So yeah, that's really interesting. And NPC, we've published research on the role that funders can play in supporting children in care. And some of our clients fund initiatives that support young people who are care experienced. We've talked quite a bit about charities, but what do you think are the messages from your review for funders?
Yeah, so I mean, I would be really keen to see funders try and orientate themselves around particularly the 5 missions for care experienced young people. And there's a chance there to do a bit of collective impact work with a number of trusts and foundations and philanthropists coming together, channeling their efforts into either an area on all 5 missions, or a number of areas on 1 or 2 missions, and showing what's possible. So, the government response to the review will come at the end of this year. They will publish a plan which says what they're going to do over the next, however many years. We can take action now. We can start doing some of this stuff now. We could back an area that says we're going to end homelessness for the care experienced population. We could try and double university take up and access in a couple of local authorities. So I think, and I've already spoken to a couple of trusts and foundations about this, I think that those missions give maybe a bit of structure around what is it we're trying to measure, what are the foundations for a good life for care experienced people, and and it has that sort of wider buy-in rather than initiatives being funded to do a thing in isolation. Actually, there's a bigger whole here that we're working towards.
Yeah, I think I really like that, and especially mentioning collective impact. I know that's something a lot of funders are already thinking about how they can do more of. So it's a really nice to have that tangible example as well.
Exactly. I give you an example. And I was talking to an organisation yesterday about this. That if we picked one local authority, one place in the UK, in England, and said, actually, we're going to achieve the 5 missions in the next 3 years. Let's raise £1 million. Let's get 5 or 6 organisations in to help that local area do it. Let's get the buy-in from those public bodies. That package can be put together now. We don't need to wait for anyone else. We can do that. We can do it in a couple of places. So I would just sort of encourage people to get cracking with it and put their elbow to the wheel, shoulder to the wheel,
yeah.
bit of the limb.
Yeah, great call to action. Thank you, Josh. And thank you for answering my questions. Some really insightful and thoughtful kind of things that you posed to the audience there. We've got a few questions from the audience, so I'm going to go to those now, and we'll try and answer as many as we can in the time that we've got left. So the first question is from Cheryl Burton, who asks, how do you see this resurgence in the voluntary sector being catalysed? So the issue of the dramatic increase in private sector provision versus voluntary sector has been going on for some time. Wouldn't reversing it require some pretty big interventions?
Yeah, in some levels it would. So government needs to put some capital into the system to allow that to happen and focus that capital on not-for-profit options, which is an argument I made at the spending review last year. The Department for Education did get some capital funding in the spending review. So I think that the details of that will be published, I think, in the next couple of months. So there will be, some capital allocation to support new options in residential and secure care. And I think the third sector needs to be ready, if they're up for that, to step in and work with some local areas and local councils to create those options. And then we need to reset the whole way in which we plan for and recruit and build options of care for children. So that's why the reviews recommended taking this responsibility off local authorities, putting it into regional care cooperatives that are owned by groups of local authorities, but that have got the dedicated capability and focus and scale to do a couple of things. One is do some proper needs assessment of what is it that children in that region, that area, will need from care in 3 to 5 years' time. So, over 40% of local authorities at the moment do not publish a plan for that at all. They don't publish what they think the need's going to be, how on earth they can create the fostering options and the residential care options when they haven't said what the need is, and how on earth the third sector meets that need when it has no idea what the need is, kind of speaks to the structural flaw in the system at the moment. So regional care cooperatives would say, look, here's what we think the need is going to be. And then because those regional care cooperatives have pooled in the resources of 10, 15 different local authorities, they will have the financial firepower to say, look, we think we're going to need a children's home which has got space for 4 children, that provides this kind of therapeutic intensive support to children who've had these kinds of experiences. But we will put this money in, and we can guarantee that we will pay for that provision for 5 years or the next 10 years. Now, that's the sort of financial decision you can make if you're working across 10 local authorities with some strong assumptions and projections about what the need of children will be. And in doing that, and that will just be one example, there'll be across those 10 local authorities probably 7, 8, 9, 10 things they're saying they want from care in 5 years' time. They can then strategically partner with the third sector, sometimes the private sector, and often by doing it themselves, actually then create those children's homes, recruit and train those foster carers so that they're there and ready for children when they need them. So it's a complete reset of how we do that. Now, at the moment, local authorities don't even have the headspace to get to first base on that, let alone all the way through to the conclusion of actually providing those care options. So it would be, significantly different. There's a short-term thing about capital and there's a longer-term thing about how the system gets reset.
And it's so often about that long-term thinking and the partnership working as well. So many challenges that I see all the time at in my job. So it's interesting that it comes about here too. The second question is from Angela Kale at NPC. She says, "I like your point about taking stigma out of the system now. Is there any way of taking stigma out so that care experienced adults feel less shame about their background and can get help for ongoing trauma?"
Yeah, I mean, the Samo Farah thing is interesting on this, isn't it? I think, incredible story, and it really quite a big moment in people maybe opening their eyes to some of these issues that wouldn't have had the same empathy or understanding had it not been Samo Farah who shared his story. And it has made me think as well about care experienced people, who Samo Farah is care experienced. We didn't know that, and he didn't feel able to share that for many, many years. So I think it's a point of a point of reflection about that really, and what that says. I think the more people are able to share their stories, the more people are able to see that they're recognised and valued when they do, that the care experience gives people something special to offer the world, which it does, and that we're able to give some space and support to the care experience community to realise that it is an oppressed group and to reclaim and re-own its space and identity as a community. Those are the kind of important steps for marginalised groups. So I'm gay, and I'm very, very fortunate to have been born at a time and in a country where I can marry my husband, and all of my family are there, and it's celebrated and recognised. And there are some things that happened that were, led by society and social attitudes changing, off the back of heroic efforts and extraordinary examples of leadership. There were also big changes that happened because government got ahead of the public on it and changed the law, set the tone, and ruled out that some behaviours were not acceptable. And I think there's something interesting there about a parallel for the care experience community. So, the reviewers said that it should be the civil rights issue of our time. It should be a protected characteristic. And I'm hearing, from people that are a bit reluctant about that, I'm hearing, really reasonable arguments, but arguments which are the same arguments that were made against making other characteristics, protected characteristics 10, 20 years ago. So does it not make people victims? Does it not create a sense of victimhood? Well, I don't feel like I'm a victim because in equalities legislation, it says that I need to be protected against discrimination because I'm gay. I don't feel victimized by that at all. So I think there's something about kind of the realization of this community that it's there and that we need to help give confidence to it. And I hope that, whether it's 10 months from now or 10 years from now, we've made some big progress in addressing this civil rights issue, that this community who weren't able to live with their families when they grew up as kids, it changed their life, and it changed their life forever. And it created a vulnerability that needs to be addressed and remedied because it's a massive social injustice. And at the same time, that experience has given this group of people something really special to offer the world. And we should be proud and celebrating of that contribution.
Yeah, I think it's so interesting to, as you've done, compare this to other times in our history and kind of other, as you said, what we now have as protected characteristics, and see the same cycles of conversation coming about, but just for a different group. So I think it's a really interesting parallel to draw, and thanks for sharing your personal experience of that as well. I've got a question from Rob Peston, which I think we've largely covered slightly in the conversation, but I just want to go back to it. So Rob's question is, are there any children's services currently being delivered by local authorities or private providers that could be better delivered by charities? And obviously we've spoken quite a lot about children's homes, but I wondered if there were other examples that relate to Rob's question that you wanted to share.
Yeah, no, good question. Well, and I know Rob. I think Rob used to work at Community Care, and I think he's now a journalist and has moved into this space. So if it is the same Rob, then hello and good to see you, Rob. I think there's a couple of examples that go beyond just fostering and residential care. So another one would be agency staff companies. So agencies, private sector agencies that recruit social workers and then sell them back to local authorities, at a really high rate. We've got a very high proportion of the workforce in social work is provided as agency. It's not good for kids. It adds to a churn in the system. And actually, I think we should be supporting, and we've made a recommendation about this, local authorities to create rival staff banks to undermine and bring to an end the use of very expensive private sector agency staff banks. And there's other recommendations about rules in the system to try and do that as well. There are some examples of local authorities that have worked with third sector organisations in leaving care services to provide support that have been really impressive. And it's allowed a bit more space for care experienced people themselves to sort of run and feel a bit of ownership over that system of post-leaving care support. I go back to the example of Pure Insight in Greater Manchester. They essentially run the independent visitor programme equivalent, and they provide emotional wellbeing support for those who've been in care. And the local authorities that partner with Pure Insight are kind of pretty good at saying, Pure Insight's offering us something that we struggle ourselves to deliver. So they make a bit more space for it. So I think there are examples of that. And, I think municipal local government at its best kind of realizes where the assets are in its community. And some of those assets are families. Some of those assets are community groups and church groups and schools, community settings. And some of them are third sector charity organisations, and making the best of the assets that you've got and bringing them into services is I think a no-brainer, but it doesn't often happen. So I think there are examples kind of all across the system of better partnerships that could be struck.
Great, thank you, Josh. Yeah, very interesting to hear. It's not. I mean, we've spoken quite a lot about children's homes today. It's such an important topic, but great to hear those other examples as well. We've just got a minute left. There's a question that's just come in, and I wonder if you could give a really quick answer to it, Josh, which is from, sorry, I've lost it there. It's from Jane Darlington, who's interested in your suggestion for funders to come together in sort of to help local authorities deliver their missions over the next 2-3 years. She's wondering who might lead or manage such a programme. And whether you would be willing to lead an initiative of funders if they step forward to support.
Yeah, look, so as a first point of contact, very happy to have a conversation with a group of funders about that. Yeah, I mean, in answer, I don't know who should lead it and run it, but I'm really happy, having offered that suggestion. If people are then prepared to say, look, I'm up for putting some money in, or I'm up for playing a part in achieving these missions, very happy to have a conversation, and the team can pass on my contact details.
Yes, great. Well, thank you for offering that, Josh. And thank you so much for your time this afternoon. We've come to the end of our session, but it's been a real pleasure talking to you. I hope that most of you, I'm sure, have found it really informative and interesting. And as Josh said, please, if you haven't already, go and read the review. It makes for really, really interesting reading. And there's lots of brilliant case studies in there as well, which really help to illustrate some of the points made, which I found really helpful. It's clear, Josh, that you're very passionate about some of these issues from the way that you're talking about it, and hopefully we'll see the changes that you want to see coming forward. So thank you so much for your time. Thank you to you in the audience, and for those of you who asked questions, and just for coming along and listening as well. So thanks everyone, enjoy your afternoon. Thanks, Josh. Bye.
Bye-bye.